Welcome back to Preferred Medicare. I'm Holly Cohen, licensed independent broker, and today we're discussing Medicare Advantage versus traditional Medicare. In the last video, we talked about why Medicare Advantage is under scrutiny. Now, let's dig into the financial and practical differences between these two options when you are on Medicare. Let's start with the cost comparisons between Medicare Advantage and traditional Medicare. On the surface, Medicare Advantage plans seem cheaper. Over 70% of people with these plans pay $0 in monthly premiums. But remember, these plans are for profit, meaning they have to make money somehow. This often results in higher out-of-pocket costs when you need care. Enrollees in Medicare Advantage still pay for Medicare Part B premium for outpatient services, which this year is $174.70 a month or higher for higher income beneficiaries. The drug benefits are usually included in an Advantage plan, so there's no need to buy a standalone Part D plan. Plus, there are often perks like free gym memberships, limited dental and vision coverage. Yet, despite these benefits, there are hidden costs. Traditional Medicare, while generally more expensive upfront because you have to purchase a Medigap plan to fill in the 20%, offers more comprehensive coverage, especially when paired with a Medigap plan. One major drawback of Medicare Advantage is the network restrictions. Many of these plans are HMOs, meaning you have a limited number of doctors and hospitals to choose from. And if you need to see a specialist who is not in network, you might be completely out of luck. Even with a PPO, you might be out of luck. Under traditional Medicare, especially with a Medigap plan, which can cover up to 100% of certain costs after a very small deductible of $240 for the year. Another issue with Medicare Advantage is the requirement for pre-approvals for certain procedures or tests. This adds to the administrative burden and can lead to delays or denials of very necessary care. According to a report from the U.S. Department of Health and Human Services, Office of Inspector General, 13% of prior authorization requests denied by Medicare Advantage plans actually met Medicare coverage rules. What does that mean? Original Medicare would have covered it, but 13% of the people that needed care were denied coverage because they were on Medicare Advantage. The 13% of the people that were on Medicare Advantage were denied the coverage that they would have been approved by on original traditional Medicare with a Medigap plan. The long-term flexibility of your Medicare plan is another critical factor. Switching from a Medicare Advantage plan back to traditional Medicare can be difficult, especially if you want to add a Medigap plan, Medigap coverage to it. There's one time that you're allowed to purchase a Medigap plan without the underwriting health questions where you could be denied coverage. And there are different rules within each state. But typically, around your 65th birthday, everyone across the United States has 6 months prior and 5 months after to enroll in a Medigap plan, such as a Plan G, without being denied any coverage because it's your personal open enrollment window. If you are retiring after your 65th birthday and you still have group health insurance and you have not yet enrolled in your Part B for the first time, you also are entitled to that 6-month personal enrollment window where there are no health questions. So they cannot deny you for health status or deny coverage altogether for pre-existing conditions. It's also worth noting that Advantage plans can be subject to changes that affect your access to care. For example, if your health deteriorates and you require more specialized care, a Medicare Advantage plan might not cover visits the best way to see your specialists, and you can face significant out-of-pocket costs, especially if you have to go out of network. On the other hand, traditional Medicare allows you to see any doctor or specialist that accepts your red, white, and blue Medicare card. So that paired with Medigap allows you more predictable costs and broader access to your healthcare services. So lastly, let's talk about the overall satisfaction and health outcomes between these two options. A 2022 review by Kaiser Family Foundation found evidence that neither Medicare Advantage or traditional Medicare offered better health outcomes. So that wraps it up for today and going over some unknowns about Medicare Advantage and Medigap in this environment that we're in 2024. Please stay tuned and stick close to this channel because we will be updating you for 2025. Again, there will be significant Medicare changes headed our way for both Medicare and Medicare Advantage and Part D heading into the annual enrollment period for 2025. That's all for now. I'm Holly Cohen, licensed independent broker. And as always, please be well.